And then there's another one, the soft spot. That's the bit on the scalp that parents think, oh gosh, there's a gap here. It's next to my baby's brain. It is nowhere near your baby's brain.
Hello everyone, this is Pediatrics To-Go, and thank you for tuning in again to listen to us. We are appreciative of all the followers that we have and all the subscribers. Over the last few months, our videos and content have become more watched and more relevant to medical care at this time, and we're very excited to bring you all the up-to-date information that we know you need, or that we think you should know. So today I have Dr. Ayoade. Dr. Ayoade comes, she's actually a pediatrician. We both graduated from medical school about 34 years ago, and she's a wonderful person. She's now here with us in Lagos at Pediatric Partners, and we're very excited to have Dr. Ayoade. And I actually have Dr. Ayoade on the program today. So Dr. Ayoade, thank you for being here.
Thank you, I'm glad to be here.
It's so exciting to have you on our program, and also to have you as part of the team at Pediatric Partners, revolutionizing pediatric care in Lagos and in the world.
I am excited to be with you.
Okay, so today we're going to be talking about the newborn period, the first 2 weeks. I know that a lot of parents come in with questions about the newborn period.
Sure.
And we're going to have Dr. Ayoade here giving us tips about that period, which can be quite overwhelming for new parents. So Dr. Ayoade, take it away.
Absolutely. So your new bundle of joy comes home and it's like, wow, what to do? So usually the first things I get asked are, I'm so scared. Is my baby breathing while it sleeps? I don't know. I keep coming to check my baby. So basically, I just advise mothers, put your baby back to sleep. Your baby must be on their backs to sleep. We don't put their babies on tummies to sleep, on their backs. Make sure the room is not too hot and not too cold. Your baby will tell you. Your baby will be uncomfortable, your baby will cry, will fidget, so you can regularize the temperature in your baby's room.
That's a good point you bring up about being not too cold and not too hot. A lot of parents overdress their babies.
Absolutely.
And they come with the hat,
especially in the tropics, it does not work.
And it's like, Mom, if you're hot, your baby's hot.
Exactly.
And if you're cold, your baby's cold. So you want
Absolutely.
to make sure you're not overdressing. So that's a very good point. Thank you for bringing that up.
Excellent. And then there's another one, the soft spot. That's the bit on the scalp that parents think, oh gosh, there's a gap here. It's next to my baby's brain. It is nowhere near your baby's brain. You don't need to put oil. You don't need to put string. You don't need to put anything on it. It's there because the brain plates, the brain bone leaves that gap so the brain can grow and expand. So you have that gap there, and it's supposed to be there. Another question I get asked is, especially with baby girls, and it's always with baby girls, my baby's breasts are growing. Have you had that before?
All the time.
Yes. What's going on? And then sometimes they see a little bit of a vaginal discharge. What's going on with my baby girl?
Or even a little bit of blood.
Exactly. Yeah. So I try and explain that, look, when baby was inside, she was sharing your hormone levels. Now baby is out. Her hormone levels are regularizing, and those are the two signs, the breast enlargement and the vaginal discharge.
Boys tend to get that too.
Exactly.
Coming with breast buds too.
Exactly. Yeah. So after a few weeks, it does just go on its own. You don't need to squeeze the breast, please. Don't need to put hot water. Don't need to do anything. Just leave it alone and it'll settle.
Sometimes when they squeeze the breast, they can introduce infection. And then those children coming with mastitis.
Exactly.
Very red, very tender breast buds.
Yes.
We call them breast buds because that's what they are. They're just from estrogen excess in the body. And for boys and girls, it's the same treatment. Leave it alone and it'll
just go on its own.
Usually in about a month.
Absolutely.
4 to 6 weeks.
Absolutely.
It tends to get better.
So another one is the umbilicus. How do we look after that? Our grandmothers in those days used to put different things, and I won't go through that, but the question is, how do you look after the umbilicus? And basically it's just cotton wool and spirit. Usually with each nappy change, just clean gently around the umbilicus and leave it. After a while it dries off, and of course the cord drops off.
When is the best time? Usually parents say, it's been a week and the cord hasn't dropped off. Sometimes.
Sometimes it's like that, but I think there's a normal gauge, a range of dates that it can drop off, because some can drop off in 5 days, some can drop off in 8 days.
Yeah.
So there is a bit of a range. As long as it's drying off and you're not tugging it, it's not sticky or there's an odor from it, then it's okay. It will drop off.
And then generally, if it's been 2 weeks and the cord hasn't dropped off, we start to worry about immune dysfunction.
Exactly.
Because sometimes that means the immune system is not drying up that umbilical stump so that it can fall off. And then those babies need to be evaluated properly, especially if your baby's a month old and still has the cord there.
Absolutely.
That child needs to be
Definitely you need to bring your baby in then.
by a pediatrician, preferably.
Absolutely. What else do we
Rashes. Oh, there's so many different types of rashes.
So many different types of rashes.
Yeah.
And I think sometimes mums like to put a lot of hair oil on their babies' heads. Yes. And I think that is the genesis of most rashes. You start having that little rash on the hairline, you start having it trickle down, babies react to some of the skin products as well. So I always tell parents, if you start with a product that is okay with your baby, don't change. If you use one product, one brand this month and it finishes, try and get the same brand. Don't keep shopping and changing because your baby may react to whichever one, and then just stick with it.
I think that's a good point, because most times with newborn skin, their skin is so sensitive, like you said. Yeah. And even when relatives come and they're like, oh, there's a newborn baby in the house, and they have all their creams and perfumes that they've rubbed on themselves. Yep. You put the baby up here, the baby's face is in contact with auntie's makeup or perfume and things like that. Next minute, the face is one of the most sensitive parts of the body for the newborn. So parents are like, what cream do I put to take away the rash? Yeah. And we tell them, we say, less is more. Use water and a washcloth, wipe your baby's face, the rash will go away.
Exactly.
And most times it does.
It does, it does. And just going further down is Napy Rash. Of course, that is always a question, Napy Rash. I always try and advise using a barrier cream. They're different ones. Some people, even just the ordinary Blue Seal works all right, or some other brands, I just really don't want to mention that, but some other brands of a barrier cream work just as well. And it's just a protective layer that stops the urine from the nappy getting on the baby's skin and causing a bit of a rash. And most times with rashes, once you expose the baby's bottom a little bit for a few days, it just clears up on its own. So those are the common ones that I can get up to.
I have one more question. A lot of moms say, my baby's always sleeping at night. No, sleeps during the day and awake at night. What do you do? What do you tell them?
Well, usually the newborn babies, they sleep, 7 to 18 hours a day anyway. That's all they do, eat and sleep. And we don't like to change their pattern. And as they get older, their pattern does change. Of course, in the first 4 weeks, the pattern is one day is different from the next. And basically, babies are sleeping. And I tell them sleeping time is actually growing time. So don't try and force your baby to wake up, except if it's after 4 hours, where your baby must have a feed. And babies are so good. They can feed while they're apparently sleeping. So yes, so sleeping is fine. There's nothing to worry about, except when you now get older babies and you feel that baby was sleeping maybe about 8, 9 hours and now is sleeping 10, 12 hours, then that is a sign something may be wrong with your baby. Because if your baby's sleeping too long, longer than its normal pattern, baby needs to be checked out, because that may be the first sign of maybe an infection or something.
All right. So there's a whole, there's a lot of other questions that come up, but we will address them with time. And just because of the time limits we have on our programming, we usually have to say goodbye at this time, and we'll be back with more information and more topics to discuss. So thank you so much, Dr.
Thank you.
Great. And we shall be seeing you soon. Thank you everyone for listening, and have a good day.
Thank you.